Good morning, everybody. Today we're going to talk about teaching strategies that you could utilize when teaching pharmacology, and in particular about the endocrine system. So I chose three different types of teaching strategies to utilize when teaching the drugs of the endocrine system. And just so we can cap things up, an instructional strategy, it's the way information is taught that brings the learner into contact with what is being learned. It's combining a variety of methods that improves the retention rates and positively affects learner outcomes. So this is why it would do best for you to use more than one type of teaching strategy. The three teaching strategies that I chose were case studies, lecture, and gaming. So first, let's talk about case studies. So case studies, the learning domain is going to be cognitive and affective. That's the two that you can accomplish with this type. So cognitive would be the thinking part, and affective would be the feeling part. The teacher role when using case studies would be that you guide and you focus the discussion. The learner role would be one of an active role, not a passive role. So let's talk about some advantages of case studies. So some advantages of case studies are that it promotes quick thinking. And so as we know as nurses, quick thinking is really an important skill, especially when things happen, all the time that you're not expecting, and you have to be able to think on your toes. Another advantage is the application of facts to practice. So it helps them to make that connection. It can be part of an independent study. It does focus a lot on critical thinking skills, especially when you do a multi-level case study. The thing that they really stress about case studies and all the research is that it safely exposes the student to real life. So I can give them an example of something that happened in real life and ask them what would they do. So that way they're practicing it not actually on the patient. It is learner and subject centered, which is an advantage. It's less isolating and requires a more active approach. It fosters peer relationships. It reinforces previous learning. And it applies the concepts of real-life scenarios. So case studies can be simple or they can be complex. It depends on where you want to go with it. Now the limitations of case studies are that one or more may dominate. So if you have someone who is more aggressive and when you separate them into teams, that could be a problem. It's easy to digress from the topic. So shy learners may not become involved. They may allow the more aggressive or the more verbal person to speak up about the case study. It can be challenging for a novice teacher and for shy, especially when they're shy students, to get them to engage. They say that case studies are time consuming and that it does require the teacher as a facilitator during the session. So they say that teachers have to have good questioning skills. So that's some of the advantages and the limitations. So here would be an example of one of the case studies that I would give. Since I am responsible for teaching the endocrine system, a big part of the endocrine system with the drugs are for diabetics, type 1 and type 2. So this would be an example of a case study. So I would ask the students, I could split them up to do several case studies, so that way it could give them a different approach. So case study number 1. You're caring for your adult male client with diabetes mellitus type 1. At 7 a.m. the client's blood sugar was 263. You give him his AM insulin. And then it would be questions like what dose will you give him? And ask them to document the blood sugar and the insulin on a documentation sheet. So by doing this case study, I would actually be asking them to use a sliding scale or to even figure out a correction factor depending on what type of insulin and what type of orders we have. And then the case study progresses to ask them, so at 11 a.m. the client's blood sugar is 185. Is there any action required? And document. So I would definitely have to have some doctor's orders ready for the students to be able to practice with. And then we progress to your research nurse tells you that this client needs to review the insulin administration procedure. She asks you to do a review of single insulin administration. Describe what you would do. So in this part, we would actually have them describe the actual psychomotor skill. And then at 5 p.m. the client's blood sugar is 51. So this is very important because hypoglycemia and diabetics you have to know how to treat right away. This is not something that you want to have to go to look to see how to treat. So what action will you take? What will you do about the 5 p.m. insulin dose? What might have caused the client's blood sugar to be low? You tell the client that his blood sugar is 51 and he says, I knew it, I was feeling hungry. What specific symptoms might the client manifest? So this would be an example of a multi-level case study. So that would be teaching strategy number 1. So teaching strategy number 2 would be lecture. So a couple of things to remember about lecture is that it's a highly structured method by which the educator verbally transmits information directly to a group of learners for the purpose of instruction. So lecture is one of the oldest forms of teaching. It's most often used. It includes 3 parts, an introduction, a body, and a conclusion. And most of the time the use of audio visuals helps out, like with PowerPoint or videos. The cognitive domain of lecture, the domain of lecture is going to be cognitive, which is the thinking domain. The teacher role is that you present the information. The learner role is that it's one of a passive role. So this can be seen as a negative. Advantages of lecture are that it's cost effective and efficient. It targets large groups. It's useful in demonstrating patterns, main ideas, summarizing data, presenting unique ways of viewing info. It's good for lower levels of cognitive domain, not higher. It provides functional background, and it's easily supplemented with audio visuals and handouts. So limitations of the lecture method. It's ineffective in the affective and psychomotor domain, because remember, it's a passive role. It's a low stimulation and participation setting. It does not accommodate individual differences or backgrounds, attention span, or learning styles. The diversity of students makes it impossible to reach all students equally. And then all learners are not exposed to the same information. And that's because of the individual differences of background, attention span, or learning styles. So the one main problem with lecture is that it's not individualized. But like was said earlier, it is one of the most common and it's one of the most cost efficient, so it is used. So for lecture, this would be, I would do it with PowerPoint, and so I'll give you one example. So we're going to go back to the diabetic. So I would cover oral anti-diabetic drugs, and there's 6 types of oral anti-diabetic drugs. One is the biguanide classification, and that drug is metformin. So we would cover the actions, the uses, the adverse reactions, the contraindications, interactions that could happen, patient teaching and nursing implications. So for example, the actions of metformin is it inhibits hepatic glucose production and increases sensitivity of the peripheral tissue to insulin. And it's used in type 2 diabetes management, usually in combination with other drugs. Adverse reactions, you'd want to teach them the most common GI symptoms, which are usually GI symptoms such as abdominal bloating, nausea, cramping, feelings of fullness, a metallic taste, diarrhea. And what's important to know is that these adverse reactions, they usually are at the start of therapy, but if the patient can wait it out, they usually go away, or if the doctor may have to even decrease the dose. Contraindications of the biguanides are that it's renal disease or alcoholism, then you can't use these drugs. A nursing implication for a patient that takes metformin, interactions with this drug or with iodine, and it can cause acute renal failure and lactic acidosis. So this is would be an important point for the student to know, that when their student is on metformin, if they're ordered a CT scan with iodine or MRI, they can't have that test done if the drug's not held. So the drug has to be held that day, and then it has to be held 48 hours after. So that would be nursing implication, and that would be something you'd want to stress to the student. So patient teaching, you'd also want to teach the patient about the adverse reaction so that they're not surprised when they have it. And then you'd want to let the student know the importance of teaching the patient about the interactions with the iodine, because you want the patient to know this so they can tell the nurse this when they go to the hospital and have tests ordered. Another thing about the patient teaching is teaching the patient to take the medication at the same time every day, about checking their CBGs. Just because they've taken the medicine doesn't mean that it is actually controlling their blood sugar, so they need to do daily CBGs or whatever the doctor told them to do. And then because there is that risk of lactic acidosis, the patient needs to know what are the signs and symptoms of it and be aware of it. So that would be just one, that would be how I would present the lecture part, would be through PowerPoint, and then going through the actions, uses, adverse reactions, contraindications, interactions, the patient teaching and nursing implications. And then the third form of an instructional method that I would use would be the gaming method. So the gaming method, and the definition of gaming is it requires the learner to participate in a competitive activity with preset rules. It's interactive. It's an interactive teaching strategy, and it can be in an individual or group. So I chose to use the gaming method in two different scenarios. So because the drugs, there's so many and there's a lot to know, I would make a puzzle for every classification. So like for the diabetics, the diabetic drugs, make a puzzle for that. For the steroids, for the adrenal drugs, do it all a puzzle each time we did a section. And then we would also play a game called Name That Drug. But before I go to the actual game, I did want to mention too that gaming is in the cognitive and affective domain, which is the teaching and which is the thinking and the feeling. So you can tap into those two. The teacher's role is one of an overseer, a referee, and a debriefer and a facilitator. So the learner role is going to be very active because they're playing the game. Advantages are that it enhances skill acquisition, it improves problem solving and clinical reasoning processes, and it requires active participation, which is a good thing because that makes better memory. It's the engagement of learners. It improves recall and long-term retention because the learner enthusiasm is higher and learner involvement is higher. So this is what studies show improves recall and long-term retention. So they say in books that gaming is like fun with a purpose, and it adds variety to the learning experience. Limitation of the gaming teaching strategy is that it's competitive, so some may feel threatened in this environment, especially for the shy and non-aggressive. The group sizes may differ, so that could be a limitation, because if I do a game that only 2 or 3 can be in a group, then it may get to be too cumbersome. You have to have flexible space because you do have to separate them. The potential for elevated noise level exists. It may be too physically demanding. Well, actually, it's going to be more physically demanding. It can take longer, and it may be difficult to evaluate the level of learning if there are several players, and it can be costly. So the game that I chose for the endocrine system would be called Name That Drug, and it would be a quick way to help students integrate commonly used meds into their knowledge base. So what I would do is I would give 5 to 7 clues about a drug, and I would start with the clues from general to specific. I would separate the class into 2 separate teams. So the first team would start, and they would, and like let's take for example, the first drug would be prednisone. They wouldn't know this, but the 7 characteristics that I would give them would be, and starting from general to specific, would be: number 1, give oral doses with meals; number 2, not use with fungal infections; number 3, slows wound healing; number 4, can cause weight gain as a side effect; and number 6 is you do not stop it abruptly; and number 7, which is the most specific, is that it's an anti-inflammatory and immunosuppressant. So how this would go is the first team would flip a coin. So whoever got heads would go first, and they would tell me, we can name that drug, and they would say, since there's 7 clues, we can name that drug in 4 clues. So what I would do is I would show the first 4 clues. So if the other team decided that they wanted to name that drug in 1 or 2 clues, they could actually take the hand. So if the other team would say, I can name that drug in 2, so then whoever can name that drug in the least amount of clues gets to go. So, and if that is decided, so if the other team would come with a counter offers, I can name it in 2, then the first team, who was supposed to go first, they can either say, well, we can name it in 1, or they can say, well, then go ahead and name that drug. So they would get a chance to name it, and then if they would get it wrong, then the other team would get a chance to go for it. So whoever would get that question right, then they would go first for the name one, for the next drug. So that would be the gaming method that I would choose to use. So in conclusion, it's really important that you try to use more than one instructional method and that you are prepared. So the three that I think I would like to go with would be the case studies, the lecture, and the gaming for the endocrine system. And so that's it. Thank y'all and have a good day. Bye.